Assalamualaikum Warahmatullahi Wabarakatuh. Hello everyone, my name is Dina Nikmatul Ulya. I'm from Faculty of Medicine, Universitas Islam Sultan Agung Semarang, and I want to a presentation about consort explanation and elaboration. The first is title and abstract. In number 1.A is checklist item is identification as a randomized trial in the title. In the title of my journal is Association of Intravenous Immunoglobulin plus methylprednisolone versus immunoglobulin alone with course of fever in multisystem inflammatory syndrome in children. And number 1.B checklist item is structure summary of trial design, methods, result, and conclusion for specific guidance is in abstract. And in my journal, the trial design is retrospective cohort study drawn from a national surveillance system with propensity score match analysis. And the methods is IVIG or immunoglobulin, and methylprednisolone versus immunoglobulin alone. And the result in my journal is among 181 children with suspected MISC, 111 fulfill the World Health Organization definition. And the conclusion is among children with MISC treatment with immunoglobulin and methylprednisolone versus immunoglobulin alone was associated with a more favorable fever course. Study interpretation is limited by the observational design. And the second topic or section is about introduction. In introduction, there are 2-point checklists in background about scientific background and explanation of rationale in number 2.A, and in number 2.B is specific objective or hypothesis. In my journal, number 2.A is about children account for only 1% to 2% of hospitalized patients with coronavirus disease 2019 or COVID-19. However, in April 2020, severe systemic hyperinflammatory disease was reported in children in Europe and the United States, occurring 2 until 4 weeks after severe acute respiratory syndrome, coronavirus 2 or SARS-CoV-2 infection. And number 2.B is the goal of this retrospective cohort study was to compare the outcomes of children with MISC associated with SARS-CoV-2 infection treated with immunoglobulin and methylprednisolone versus immunoglobulin alone. Next section or topic is in methods. There are trial design, participants, intervention, and outcomes. First is trial design. In trial design, the checklist item is description of trial design, such as parallel, factorial, including allocation ratio. And in number 3.B is about important change to methods after trial commencement, such as eligibility criteria with reasons. In trial design, in number 3.A, in my journal, is this retrospective cohort study included 111 children with MISC. After propensity score matching, the rate of treatment failure defined by the persistence of fever 2 days after the introduction of first-line therapy or recrudescence of fever within 7 days for those who receive immunoglobulin plus methylprednisolone versus immunoglobulin alone was 9% versus 51%, a difference that was statistically significant. And in number 3.B is all children with confirmed MISC associated with SARS-CoV-2 infection fulfilling WHO criteria up to October 22 in 2020 were included in the study. The final date of follow-up was January 6 in 2021. Next topic or section is participant. The checklist item in number 4A is eligibility criteria for participant. The criteria is children and adolescent 0 to 19 years old fever, more than 3 years at 3 days, and 2 of the following rash of bilateral non-purulent conjunctivitis or mucocutaneous inflammation signs. Next, is number 4.B is about settings and location where the data were collected. The settings and location where the data is collected in my journal is the reporting of all suspected MISC cases in France became mandatory since the first description of this entity in April 2020. This reporting was coordinated by the French National Public Health Agency with a methodology previously published. Next topic is intervention. The checklist item is the intervention for each group with sufficient details to allow replication, including how and when they were actually administered. In my journal is all French pediatric hospitals were mandated to report any suspected case of MISC to the French National Public Health Agency without waiting for the SARS-CoV-2 antibody test result. All children with confirmed MISC associated with SARS-CoV-2 infection fulfilling WHO criteria up to October 2020 were in October 22 in 2020 were included the study. The final date of follow-up was January 6, 2021. Next is outcomes. In checklist outcomes, number 6.8 is about completely defined pre-specified primary and secondary outcome measures, including how and when they were assessed. In my journal, the primary outcome was treatment failure, defined as persistence of fever for 2 days, which is 48 hours after the introduction of initial therapy, or recrudescence of fever within 7 days after the initial therapy in children who received immunoglobulin and methylprednisolone versus immunoglobulin alone as first-line therapy. Time was measured from the start of administration of immunoglobulin or methylprednisolone. And the secondary outcomes were second-line therapy defined by secondary treatment such as steroid or biological agents for MISC prescribed at least 24 hours after the initial therapy. And number 6.B is about any change to trial outcomes after the trial commenced with reason. This outcome, in my journal, this outcome is similar to the primary outcome used in therapeutic studies of Kawasaki disease and has been associated in Kawasaki disease with increased risk of further cardiovascular complication. Next is about sample size. In sample size, the checklist item is how sample size was determined and when applicable, explanation of any interim analysis and stopping guidelines. In my journal, from available data and prior to any data collection, assuming a risk of treatment failure of 50% in the immunoglobulin alone group, and that the risk with immunoglobulin and methylprednisolone will be reduced to 20% with a total of 76 patients. The study was estimated to have 80% power to detect such a difference, assuming two-sided test. Next, in randomization. In randomization, the topic is sequence generation. The checklist item is method and type of randomization. The method in my journal is an electronic case report form for each patient was stored in a secure database based on clinical and biological files and shared by each pediatric hospital. The following data were recorded: demographic characteristic, comorbidities, initial symptoms, and clinical signs, biological and microbiological parameters, radiography findings, treatments, and course during hospitalization. Next is about allocation concealment mechanism. The checklist item is mechanism used to implement the random allocation sequence. In my journal, is the main analysis involved propensity score matching. The propensity score was calculated with a multivariable logistic regression model to establish each patient's probability of receiving combination therapy with corticosteroid according to baseline characteristic. Next topic or section is implementation. Checklist item about who generated the random allocation sequence, who enrolled participants, and who assigned participant to intervention. In my journal is 2 research members, NO and FA, classified each case as confirmed MISC or not following World Health Organization or WHO criteria. All children with confirmed MISC associated with SARS-CoV-2 infection fulfilling WHO criteria up to October 2022, 2020 were included in the study. The final date of follow-up was January 6, 2021. Next section is blinding. The checklist item is if done, who was blinded after assignment to intervention and how. In my journal is conditional logistic regression analysis was performed with the match cohort to test the association between treatment groups and each outcome with findings expressed as absolute risk differences, odds ratios, and 95% CLS. The analysis was also adjusted for center by using random effects modeling, which involved fitting a mixed effect logistic regression model. Next is statistical methods. Next is statistical methods. The checklist item is statistical methods used to compare groups for primary and secondary outcome, and methods for additional analysis, such as subgroup analysis and adjusted analysis. In my journal, statistical methods is because of the small sample size, subgroup analysis were conducted with the inverse probability of treatment weighting approach. Pre-specified subgroups for analyzing the primary outcomes include presence or absence of initial acute left ventricular dysfunction. And the number 12.B is 6 sensitivity analyses were performed to assess the robustness of the study findings. There are 6. Yes, 6. First is the data were analyzed using inverse probability of treatment weighting. The second is a propensity score. The third is a propensity score, which is matched analysis was conducted with double adjustment. And the fourth is a propensity score, matched analysis was conducted including the duration. I'm sorry, in number second is propensity score, which is match analysis was conducted with center as a fixed effect. And number 5 is a propensity score match analysis was conducted including mechanical ventilation. And the 6th is a logistic multivariable regression analysis adjusted on the variables included in the propensity score was conducted. And the result, next is result is participant flow. This is the flow chart or flow diagram. There are 181 participants, 70 excluded, 111 with confirmed MISC, 5 patients receive neither immunoglobulin, and 106 with confirmed MISC. Sisanya ya dikurang. And then 106 is 34 of them is receive immunoglobulin and methylprednisolone, and the 72 receive immunoglobulin alone. Two patient is not matched and in immunoglobulin and methylprednisolone, and patient who receive immunoglobulin alone is 8% is not matched, and 30 in immunoglobulin and methylprednisolone, 32% is included in the primary analysis, and in immunoglobulin alone, 64% propensity score matched children included in the primary analysis. Next is recruitment. In recruitment, the checklist item is dates defining the periods of recruitment and follow-up, and why the trial and or stop. The date is in April 2020, and why the trial and or will stop is because among the 72 children who receive immunoglobulin alone, 33% receive second line therapy, which is a second immunoglobulin course alone in 14, immunoglobulin and methylprednisolone in 11, methylprednisolone alone in 2, and a biological agent in 6. 16 children show acute left ventricular dysfunction after initial therapy, and hemodynamic support was introduced or added for 17. Next is baseline data. This is the baseline data. The checklist item in baseline data is a table showing baseline demographic and clinical characteristic for each group. This is the table in my journal. Next is number analysis. The checklist item is for each group, number of participants included in each analysis, and whether the analysis was by original assigned group. Next is outcome and estimation. The checklist item is for each primary and secondary outcome, result for each group, and the estimate effect size and its precision. And then for binary outcomes, presentation of both absolute and relative effect size is recommended. In primary outcome, among the 106 treated children, 32 in the immunoglobulin and methylprednisolone group and 64 in the immunoglobulin alone were matched based on the propensity score. And the secondary outcome, treatment with immunoglobulin and methylprednisolone versus immunoglobulin alone was associated with a lower rate of second-line treatment. And in number 70.B, the dosage of immunoglobulin was 2 grams per kilo for all patients. A total of 34 patients in the immunoglobulin and methylprednisolone group received methylprednisolone at 0.8 to 1 milligram per kilo every 12 hours. Next is ancillary analysis. The checklist item is result of any other analysis performed, including subgroup analysis and adjusted analysis, distinguishing pre-specified from exploratory. And next is harms. The checklist items is all important harms or unintended effects in each group. Next is discussion. In discussion, there are limitations. The checklist item is trial limitation, addressing source of potential bias, imprecision, and if relevant, multiplicity of analysis. In my journal, the limitation is this study has several limitations. First, it was not a randomized trial. Second, it's not certain that all patients had MISC. Third, there was variation in the dosage and routes of steroid treatment used among the 34 children who received immunoglobulin and methylprednisolone as first-line therapy, and the study design didn't allow for comparing regimens. 4 patients in each treatment group may have 10 to present to the hospital at a different time in the natural course of this disease. 5, patients with initial MISC may show symptoms of septic shock and initial treatment with immunoglobulin and methylprednisolone. 6, although no deaths occurred in the study population, and despite mandatory reporting by the French National Public Health Agency, understatement is a possibility. Next. Okay, next topic is generalizability. The checklist item is generalizability of the trial findings. In my journal, is corticosteroid use is currently one of the few validated therapeutics in severe respiratory adult forms of COVID-19. Next is interpretation. The checklist item is interpretation consists with result balancing benefits and harms and considering other relevant evidence. In my journal is among children with MISC treatment with immunoglobulin and methylprednisolone versus immunoglobulin alone was associated with a more favorable favor course. The combination therapy was also associated with less severe acute complication, including acute left ventricular dysfunction and hemodynamic support requirement. Next is other information. In other information, the first topic is registration. The checklist item is registration number and name of trial registry. In my journal is the study was approved by the Insert Ethics Committee for evaluation. This is the number registration ERIRB00003888. A written information form validated by the ethics committee was given to all participants. And next is protocol. The checklist item is where the full trial protocol can be accessed if available. In my journal, another single center study reported that following the implementation of a new local protocol, including corticosteroid for MIS-C treatment, hospital length of stay decreased. And the last is funding. The checklist item is source of funding and other support. In my journal, the study received an unrestricted grant from Pfizer, is the French COVID-19 Pediatric Inflammation Consortium, received an unrestricted grant from the Square Foundation. That is my presentation about Consort analysis of my journal. I'm sorry if I have some mistakes when I'm presentation. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh.